Good morning and welcome back, my tiny human enthusiasts, to yet another episode of Pediatric Puzzles, where we dissect medical mysteries with a side of giggles. Today's topic might be not the most glamorous, but hey, it's a fact of life: constipation in children. This one's called the poop scoop, unblocking the mysteries of childhood constipation. Yep, we are diving deep into the world of bowel movements. Buckle up, folks, it's gonna get informative. Informative indeed. But before we get down and dirty, let's establish what exactly constipation is in our little ones. Imagine their digestive system as a highway for food. Normally, things move smoothly, but sometimes there's a huge traffic jam. Poop gets backed up, becomes dry and hard, and passing it becomes a struggle. Ouch! That sounds uncomfortable for our little ones, doesn't it? So how do we know if our child is experiencing this highway holdup? Well, that's a great question. My dear parents, look out for these signs. Fewer bowel movements than usual, think less than 3 a week, hard, dry stools that look like pebbles, straining or pain during those precious potty moments, and even leaking of stool because they are afraid to push. I know the leaking part doesn't sound pleasant. Now then you might ask, how do we as pediatric surgeons diagnose this whole situation? Well, thankfully, in most cases, it's a detective game we can play at home. You can ask your kiddo about their diet, their fluid intake and the bathroom habits. But sometimes we need to come in and do a physical examination to rule out any underlying issues. Now there are a few cases where there might be surgical issues leading to constipation. This one includes congenital non-formation of the intestine, that is called atresia, a rather distressing condition called Hirschsprung's disease where the nerves in the intestine do not function as they should, and a few others. Now usually surgery is the last resort, but there are some culprits that we need to be aware of. Scar tissue from previous surgeries, birth defects that affect the rectum and colon, along with the ones I've already mentioned, all can lead to holdup of poop. I know that sounds intense. Then you might want to know, when does surgery actually come into play? Well, we only recommend surgery if other treatments like diet changes, stool softeners or regular enemas haven't worked. The type of surgery depends on the cause. For blockages, we might perform something known as a resection and anastomosis, which is like taking a detour of the highway and then joining again on the main road. I know it sounds complicated, but if it helps our little one feel better, I do believe it's worth it. Now remember, constipation is a common childhood complaint. Most of the time, it can be resolved with simple lifestyle changes. But if you are ever concerned, don't hesitate to reach out to your friendly neighborhood pediatric surgeon. And on that note, let's wrap up this episode of Pediatric Puzzles. Remember, keeping our tiny humans happy and healthy includes a healthy gut. Until next time, keep those bowels moving and grooving. Peace out.